Emergency Preparedness Plan for Home Health and Hospice Services. Title: The Role of Home Health and Hospice in Emergency, Disaster, and Evacuation Planning. 1. Purpose. The purpose of this Emergency Preparedness Plan is to outline the role and responsibilities of home health and hospice agencies in preparing for, responding to, and recovering from emergencies, disasters, and evacuation scenarios. This plan ensures continuity of care for patients, safety of staff, and coordination with community and government emergency response systems. 2. Scope. This plan applies to all staff, patients, caregivers, and stakeholders involved in home health and hospice services. It encompasses preparation for natural disasters, e.g., hurricanes, floods, wildfires, earthquakes, man-made incidents, e.g., power outages, chemical spills, and public health emergencies, e.g., pandemics. 3. Key roles and responsibilities. Leadership team. Administrator, Director. Oversee the development, implementation, and revision of the Emergency Preparedness Plan. Emergency Preparedness Coordinator. Coordinate emergency drills, maintain compliance with regulations, and serve as the liaison with local emergency management authorities. Clinical Managers. Ensure that patient-specific emergency plans are in place and up to date. B. Staff field staff, nurses, therapists, home health aides. Educate patients and caregivers on emergency procedures and ensure patient emergency kits are prepared. Office staff. Maintain up-to-date contact information for patients, caregivers, and staff. C. Patients and caregivers. Participate in emergency preparedness training provided by the agency. Maintain emergency supplies and follow the patient-specific emergency care plan. 4. Planning components. A. Risk assessment and hazard identification. Identify potential hazards specific to the agency's service area. Assess patient populations for vulnerability, e.g., mobility limitations, oxygen dependence. B. Communication plan. Maintain updated contact lists for staff, patients, caregivers, and local emergency services. Establish communication channels, e.g., phone trees, text alerts, email blasts. Coordinate with local emergency management agencies and healthcare coalitions. C. Patient emergency plans. Develop individualized emergency plans for each patient, including evacuation procedures, emergency contacts, medical supply needs, e.g., oxygen, medications, backup power for medical devices. Distribute copies of the plans to patients and caregivers. D. Training and drills. Conduct annual training for staff on emergency procedures and use of emergency equipment. Simulate emergency scenarios through drills to test preparedness. Provide educational materials and training to patients and caregivers. E. Resource management. Maintain emergency supply kits at the office and encourage patients to prepare their own. Pre-arrange agreements with transportation providers for evacuations. Ensure adequate stock of critical medical supplies and medications. 5. Emergency response procedures. A. Activation of emergency plan. The administrator or emergency preparedness coordinator will activate the plan upon notification of an emergency. Notify all staff, patients, and caregivers of the activation and provide specific instructions. B. Patient prioritization. Triage. Patients based on medical needs and vulnerability. Assign high-priority patients to staff members for immediate contact and assistance. C. Continuity of care. Transition to telehealth services if in-person visits are not possible. Utilize backup staffing resources to ensure patient care continuity. D. Evacuation procedures. Follow local evacuation orders and assist patients who require relocation. Coordinate with local shelters to accommodate patients with medical needs. document patient transfers, and maintain communication with receiving facilities. 6. Recovery and post-emergency actions. A. Assessment. Conduct. A post-emergency evaluation to identify strengths and areas for improvement in the response. Gather feedback from staff, patients, and caregivers. B. Debriefing and support. Provide mental health support for staff and patients as needed. Hold debriefing sessions to discuss lessons learned. C. Plan revisions. Update the emergency preparedness plan based on the evaluation findings. Implement new training or resources as necessary. 7. Compliance and regulatory requirements. Adhere to federal, state, and local emergency preparedness regulations, including CMS Conditions of Participation, COPs. Maintain documentation of training, drills, and emergency incidents for compliance audits. 8. Appendices. Appendix A. Contact list for emergency services. Appendix B. Patient emergency plan. Template. Appendix C. Staff emergency responsibilities. Checklist. Appendix D. Evacuation routes and shelter. Information. Appendix E. Sample emergency drill scenarios. 9. Conclusion. This emergency preparedness plan ensures that home health and hospice agencies are equipped to handle emergencies effectively, safeguarding the well-being of patients, caregivers, and staff. Through proactive planning, training, and collaboration, we aim to maintain quality care and operational continuity during challenging times.